Hey everyone, I'm Christina from over the Coley First Nations Health Center. I work in community/public health and I'm with my coworker.
Hi everyone, I'm Jody Woodward and I am a healthcare aide and I help the nurses at the health center.
So as we are all aware, this pandemic has been in the forefront of all our minds in this last year and a half, and this has caused other viruses to not be talked about as much. So I'm here today to talk about two infections, primarily syphilis and gonorrhea. Syphilis especially has gotten to rates of pre-antibiotic levels, and we actually considered it an outbreak across the province of this sexually transmitted infection, and also as well as gonorrhea. So STIs are sexually transmitted infections, and they are infections that are transmitted sexually. They could be either vaginal, oral, or anal. Many times STIs don't actually have any symptoms, and you don't know if you have them until you get tested. The good news is that the STIs we're going to talk about today are 100% treatable, and you can actually come to the office to get treated or even tested. So syphilis is kind of an interesting bacteria. It actually progresses through 4 stages. We have primary, secondary, latent, and even tertiary. With each stage, there actually has different symptoms, and sometimes many of these symptoms actually mimic other illnesses, which often can make this very difficult to diagnose. It's always better to test and not guess, okay? So people, as I said, don't really always experience symptoms, and some people have some symptoms. But as a person progresses from stage to stage, the symptoms of syphilis may go away on their own, but that actually doesn't mean the infection's technically gone. So primary stage of syphilis will either occur 3 days to 3 months after the exposure. An infected individual will develop a small painless sore at the site of infection. So this will typically be on the genitals, or your anus, even your throat. Women can develop a sore on their cervix, and this is only visible by a doctor doing a pelvic exam. These sores will heal on their own without treatment, usually in about 3 to 6 weeks, and this is why people don't always seek out treatment, because it is a painless sore that ends up going away.
Can I stop you for a minute, Christina?
Yes.
What kind of sore are you looking at? Like, is it like a herpes kind of sore or?
It actually kind of does resemble a herpes, so it's kind of an open sore on the genitals, and it'll be painless, and usually does have some type of drainage associated with it. But then, like I said, it does heal up on its own, and better to get tested, and we can swab those sores too to see if it is actually herpes or canker of syphilis. There is a really fantastic website called sexandyou.ca, and that will go over tons of pictures, infographics, and all that stuff related to all STIs out there. So now we're going to go to the second stage of syphilis, which is usually 6 weeks to 6 months after exposure. And there's actually a wide range of symptoms in this stage. Most commonly we see flu-like symptoms. Sometimes you may have patchy hair loss. Common to see rashes on the hands, bottoms of the feet, and even the abdomen. And that rash will typically go away too. So that's another reason why someone doesn't seek out treatment, because the rash will then go away. You may also notice that you have a fever, swollen glands. You may just feel kind of generally unwell. Headaches are common, but as I'm talking, you can see those are common symptoms for many things out there. So again, another reason why people don't get testing. If you don't get treatment after the secondary stage, it'll eventually go to latent stage, which is within the 1 year after infection. So this was where a person generally has no symptoms during this phase, but lesions or rashes during the primary and secondary stage can actually reoccur, and the infection can still be transmitted. During this time, the bacteria of syphilis has a great time to multiply and continue to infect the body. Last stage is called tertiary, and this is between 2 to 30 years after infection, and this actually occurs in about 40% of untreated infected people. This stage is very, very destructive. It is a stage where long-term damage by the syphilis bacteria can result in major health complications, such as affecting the brain, the heart, the bones, even the blood vessels, and sometimes these complications can lead to death. The good news again is that this is 100% treatable. We have the treatment at the office, so it's either one of two things. We have, if you are not allergic to penicillin, you get 2 injections, and then if you are allergic to penicillin, we give you another medication, and it's just an antibiotic pill form, which is given twice a day for about 7 days. Other complications that happen is treatment can be a little bit tricky when you get into those later stages of syphilis. So in the tertiary stage, you typically have to go to the hospital and actually get IV antibiotics, or if you're pregnant, depending on how far in your pregnancy, sometimes you have to be admitted for that treatment. So complications of syphilis, if left untreated, it can potentially cause some life-threatening complications and even permanent damage to the brain, heart, bones, and like I said, the blood vessels. And sometimes it can actually cause some mental and neurological problems. And in very rare cases, if it's untreated, it can actually be fatal.
It's kind of scary.
Very scary. And sometimes, because the syphilis can actually lead to lesions and sores on the genitals, it actually increases your risk of transmitting viruses such as HIV. What we really do worry about is that if an infected mother is pregnant and she has contracted syphilis, we worry about her passing that to the baby, because it can be fatal to the baby, causing stillborn or some pretty severe congenital abnormalities and defects. And a lot of times you need some pretty long and intensive follow-up with a pediatrician. So the other STI we're going to go over is gonorrhea. And this is another bacteria that's kind of becoming more prevalent across the province of Alberta. And in regards to symptoms, most women do not develop any. But if you do develop some symptoms, it's about 2 to 7 days after infection. What you typically can see in a female is increased vaginal discharge. You may have some pain in your abdomen or even your lower back. Sometimes there's bleeding between your menstrual period and sometimes after sex, and there can usually be painful intercourse.
So when you say they increase vaginal bleeding or discharge, sorry, does it have like a foul smell, or is
It may
like
have a smell. It may be even a different color.
Different color?
Not the typical
Okay.
white that you typically see. It may be more yellow, greenish in color, especially in men. It's usually a thick green discharge, which is coming from the penis, and they may notice some testicular pain, and their penis actually may be a little bit itchy. And those are all kind of symptoms of potentially an infection of gonorrhea. So again, testing for gonorrhea is easy. We can do it with a urine sample at our office, or it can be done by a swab. So they swab the cervix or they swab the urethra of the men. Another good thing is that it's also 100% treatable, and it is treated with dual therapy antibiotics, which is done by a single dose. You just take it all at the same time, and we have the treatment again at our office. A lot of times we treat chlamydia at the same time as we treat syphilis, or treat gonorrhea, sorry. And we also want to make sure we contact any partners that you've had in the last 60 days so we can also test and treat them. Contact tracing for syphilis, I should say too. We want to go back at least 6 months to a year, and we want to contact all those partners and test and treat them as well. We ask for both treatment after gonorrhea and syphilis that you do not have sex for the next 7 days so that that treatment can take full effect. And we also want to do some follow-up, especially in regards to syphilis. We'd like to have follow-up 1 month after treatment, 3 months after treatment, 6 months, and then a year. So like I said, good news at the health center. We have the ability to test for most STIs, so chlamydia, gonorrhea, syphilis. We can either take some blood for hepatitis C, HIV as well, and we have the treatment for those viruses and bacteria at our office. And now this is the part of the presentation. I'm going to bring it over to Kate. She works with the Echo Plus program, and she's going to give some more information on other viruses we should be screening for.
Hello, my name is Kate, and I'm Anishinaabe from Ontario. I have a background in nursing and public health, and I've been working with hepatitis C for about 6 years since the new treatments came out. So some objectives for our quick time here together this morning. We're going to talk about what hepatitis C is and why it matters to us in our community, and then what we can do about it in collaboration with the Echo Plus project. So did you know that the liver is the largest organ in your body? You have to have a liver in order to live. In fact, the liver does about 500 different jobs for you. So if you sit up really tall and you take the ends of your fingers on your right hand and tuck them right under the edge of your ribs on the right hand side, that soft squishy thing under there behind the ribs is your liver, and you can feel it right there. So super simplified, so we have an idea of what your liver does. On the screen there, you can see some of those 500 different jobs that it does. It filters the blood coming from our digestive system. It makes proteins that help digest food and stop bleeding. It stores vitamins and minerals. It boosts our immune system, which is really important right now during the pandemic. And it changes medications into a usable form so it can help with pain control or other things that we need meds for. And it also filters toxins that we come in contact with in our environment, or alcohol, drugs, chemicals, anything that we come in contact with. So those are all really important things. And as you can see the picture there, the normal liver is shiny, it's soft and smooth. The tissue works really good. It's very permeable to the blood flowing through it. And then next to that, you see a picture of a liver with cirrhosis, and it looks like it's got warts all over it. That is a very unhealthy liver. When something like a virus, like a hepatitis C virus, gets into the liver and causes damage, that tissue that's affected gets fibrous and hard and like scar tissue, kind of like a scab almost, and then it can't do all of those jobs that we just talked about. So it's really important for us to keep our livers healthy and soft. So what is hepatitis and how can you get it? There are several kinds of hepatitis. I think they're up to letter E now, but we're just going to talk quickly about A, B, and then mostly about hepatitis C. Hepatitis A is commonly passed by ingestion of fecal contaminated food or water. You can get really sick, but you can prevent this one with a vaccine. Hepatitis B is passed through body fluids, and it is also vaccine preventable. And then in 1989, they found hepatitis C, and this one is passed by blood-to-blood contact. There's no vaccine for this one, but equally or even more important, we have a cure for it. So how do you get it though? So exposure can happen through blood-to-blood product. It even just takes one little drop of blood to come in contact with your blood, and then you can become infected. So blood transfusions before the early 1990s, non-sterile dental work, some of us had that when we were kids. Some of us were in a car accident, maybe when we were teenagers, they gave us a blood transfusion. We don't remember that, but we could have been infected that way. Other ways are mother to baby, sharing of needles, straws, pipes, or other substance works, non-sterile tattoos or piercing, even having a manicure or pedicure if they're not sterilizing that cuticle clipper in between people. And if you're living with someone who has Hep C and you share toothbrush or razor with them, that's another way that you can become infected with this virus. So it's important to realize that this isn't just a sex disease. A lot of us have been exposed in ways we had no idea. So it's something that can happen to you. It's not a disease that you deserve to have. It's something that happens to a lot of people, and we really don't even know that it's happened to us. So it's really important to get screened because it only takes one exposure. So here's a picture of the numbers in Canada. There's between 246,000 and 350,000 Canadians living with hepatitis C right now. And almost half of those, so 44%, don't even know that they have it, which is kind of scary because, as we talked about, all those different ways that we could have been infected and not know about it. But the Hep C virus is also sneaky because it can live in your liver for like 20 years before you have any symptoms at all. But all that time, it's causing little bits of damage to your liver. So some of the symptoms could be tiredness, headache, nausea, anxiety, depression, which I'm sure all of us have experienced some of those in the last week. So it's really hard to pinpoint what the symptoms are for hepatitis C. So another reason why it's really important that all of us get screened at least once, so we have a baseline. And then if you're engaging in risky behaviors, then you can get screened more often as well to double check. But really important to increase awareness to everybody that this is something we need to talk about, something we need to get screened for. Because now we have treatments that cure over 95% of people who have hepatitis C. Out of the top 60 infectious diseases in Canada, hepatitis C kills more people than all of those top 60 combined, and that includes HIV. So it's something that really impacts all of us, something we should be talking about. And it's also important to look at it from a wellness perspective, because when you get treated and you cure this virus and take it out of your liver can actually start to heal and regenerate that scar tissue or that cirrhosis. So it's a really good way to return your liver back to a state of wellness. So what can we do about it? Well, number one, we can get screened for it. It's a simple blood test, and then we can get treated. If you come back positive with it, it's important to get started on the treatment right away. And it's really simple, 1 or 2 pills a day for a few weeks, almost like taking an antibiotic, actually. And then once you get cured, follow up with that blood test to make sure that the virus is all gone. And then get talking about it. Talk to your family, talk to your friends, talk to your aunties, grandparents, the youth in your family. All of us, it's important to start talking about this because that will help take the stigma away so that we realize that this cure is available for all of us and it's something that we can do to return to wellness. So the EcoPlus project kind of comes in supporting this because it used to be that in order to get treated for hepatitis C, you had to travel into the city to see a specialist. But now we can use Zoom technology, and Dr. Sam Lee in Calgary has a bi-weekly, so twice a month, he sets up a session, and anyone on the healthcare team in the community can present a case to him, and he will fax in that prescription and connect you with treatment right in your home community. So lots of the barriers for treatment have been taken away, and the EcoPlus team is here to support awareness, education, and access to treatment. But most importantly, get talking about Hep C, ask your healthcare team how you can get screened for it, and then they can connect with the EcoPlus project so that we can support you in getting a cure and returning your liver to good state of health. Hello,
Thanks,
my name is
Kate.
Thanks, Kate. That was good information.
If you have any questions, you can come see me at the office and we can give you some more information about the EcoPlus project. So again, thank you guys, but let's reduce the stigma around sexually transmitted infections. You can call or come see me at the office if you have any questions or would like some testing. And also please protect yourself and practice safe sex. We have condoms at the office, both female and male, if you would like, and you can pick them up at any time. And we're always there if you have any questions. You can call myself, Christina, or Lillian, or even Jody if you want to get some more information. And our number is 780-594-2473. And we're open Monday to Friday, 8:30 to 4:30, Monday to Thursday, and then 8:30 to 2 on Fridays. So come see me if you would like any questions answered or just, like I said, want some testing. Thank you.
Thank you.